I've been working for 10 years for ADRA-UK and been involved in many development and relief projects around the world. We often complete a project, achieve the expected results, but leave without really reporting on the impact this project is making in the lives of people. Now, since October 2014, we've been implementing a DFID co-funded maternal health project in Zimbabwe. The project will end in November 2016. Now, I wanted to find out what we had really accomplished after working for 2 years on this project. Gokwe is a remote rural area in the west of Zimbabwe. If you drive west, you would end up on the shores of Lake Kariba. It is a very remote area and living conditions are harsh, with little or no access to electricity or water. Most people scrape away a living growing cotton for export. And it is here that we have been working on a UK aid co-funded project to help give pregnant women access to the best natal services possible. In rural areas of Zimbabwe, maternal mortality rates are still very high. Few ill-equipped healthcare facilities combined with the limited awareness of the benefits of maternal health services are the leading causes for high numbers of women and children dying during childbirth. Milimo Ninval is the desk officer at ADRA-UK responsible for this project. Kennedy Habasimbi is our Africa region coordinator based in Lusaka. He joined Milimo on a monitoring and evaluation trip, and I decided to follow them.
Yes, we are back from Gokwe. We spent 2 days in the field and 2 days travelling because of the distance and the roads.
So what was your impression of the project at the moment?
Overall, the project's doing very well. We have a lot of support from the stakeholders. Our project team have done very well with the implementation. Of course, there have been some challenges, but generally there's an improvement in the quality of maternal health services. There's also an improvement in the access of women of childbearing age to the maternal health services. So we're very much pleased with the progress of the project. And now in the final 12 months of the project, we'll be looking at sustainability, specifically what areas of the project can we strengthen to ensure that when ADRA has now completed the project, the community can continue with its activities and continue to drive the message of maternal health, accountability and responsibility.
The project is not 100% there yet, is it?
Well, it's not when you look at it from maybe the technical point of view, but if you're looking at the bigger picture, we are getting there. Because speaking to the beneficiaries, the women specifically, they were all showing that enthusiasm that now they are no longer having those home deliveries and they are having less complications. They are more appreciative of the infrastructure which is there now. Still need to be done a little bit here and there, but so far it's in the right direction.
Well, that sounds all very positive, but how about those motorbikes? They don't start. What's up with that?
Well, the motorbikes, we noticed that they're having a challenge of batteries, and probably it's the matter of the type of batteries which they have, and this is actually an issue which may need to be addressed to say, well, how best can we get probably the suitable batteries for the motorbikes so that they are able to start at any time. And I think this is also something which needs to be gotten into the sustainability issue so that we talk to the partners, especially the Minister of Health, who will be running this infrastructure, on how best they could be replacing such minor replacements.
One of the pumps is not working. What's going to happen there? There's no water. The clinic is functioning, but there's no water. What are we going to do to change that?
Yes, definitely we have a challenge there with the boreholes. One of our clinics in Zimbabwe, which is actually our most isolated clinic, is having a challenge in us being able to access water. And this is not specific for this clinic, but generally across the district, it's very difficult to access water. And so we are, as ADRA-UK, we are committed to supporting the project and to ensure that the clinic, the mothers and all those that also benefit from the clinic can also have clean water in the waiting mother shelters where pregnant mothers can come and stay, but also in the maternity wing. We're also working with the community as well. We have engaged them more closely than before to help us also with some of their traditional methods to be able to source water.
Now, we visited one clinic, where we've built a brand new mother daycare center. But the clinic, the operating clinic, is far, far away from there. What's up with that one?
Oh, that's an interesting situation actually, because the mother's shelter, like you've put it, is quite modern one. But the clinic where it's now standing is a new clinic which is unfinished infrastructure, and this is a clinic which was undertaken by one of the partners in the district, but over time they ran out of resources, and so it's remaining to a point where we just need to see what happens to make it operational. And as ADRA-UK, probably this is where we can come in to help to make sure that the mother's delivery room is completed, so that this mother's shelter will be operational, because as it stands now, mothers could not be attended by the clinic staff because the delivery room is not yet finished.
Melima, on that one, what is ADRA-UK offering? What are they going to do to make sure that this clinic is starting to operate? Any suggestions?
One important aspect of our work as ADRA, and specifically as ADRA-UK, is ensuring that there is community ownership and there's community participation. Without that, we could complete projects, but then at the end of the project, activities may or may not continue. So we have met with a local chief and also the local builders that are actually currently repairing and working on the clinic voluntarily. And they've informed us that the community themselves that are in the area are actually fundraising so that they can complete at least the maternity wing of the clinics, and so mothers can be using the maternity wings and the waiting mother shelter, which is currently complete. So ADRA-UK has agreed to match the community's fundraising efforts. So whatever the community raise, and we already have a ballpark figure of what we expect it to cost, ADRA-UK will match it. So that way there's participation from both, and it also ensures that the community now take responsibility of the clinic, but it also makes sure that they respect the clinic facilities and continue to support it and care for it once ADRA has completed its project.
This has been an exciting experience. We are getting into a community where really there's nothing about waiting mother shelters, and mothers have to travel more than 25 kilometers to get to a clinic. And when you are in labor, that already is impossible. So having waiting mother shelters has really helped to bridge that gap of the distances, and now the mothers can be at the shelter and they can wait there and then receive professional assistance at the clinic. The community itself is excited about this, and the mothers themselves, especially when I stop to talk to the mothers who will be at the waiting mother shelter, I think maybe somewhere if you went into the community, you'd realize that some of them, this will be the first time that they will be in a facility where there's electricity, a facility where there's water, a facility where they can actually sleep on a bed. But the main thing is that now we can be sure that they can be waiting at a safer place, they can deliver at a safer place, and we can have a healthy baby and a healthy mother, and to us that's success.
We are so thankful to ADRA for the wonderful job they did by constructing this beautiful waiting mother's home. Now no mother delivers from home. Mothers used to suffer a lot. We had several maternal deaths previously resulting from home delivery complications and distance to clinic. Now there are no such deaths, as mothers are sensitized to come here in time. Once more, we are so grateful, and may God bless you.
So what touched you the most, what you saw yesterday?
For myself, I think the most touching moment was really to visit the Nyonga clinic, the one that is currently being built, and seeing the builders working voluntarily, seeing the chief also on site pushing and driving the build. The owners of that clinic unfortunately ran out of money, but the local community are really doing what they can to support it. And for me, that was probably the highlight of my trip, because it shows that the community really do care and are committed to reducing maternal mortality in the area in Gokwe North.
What touched me most is to speak to these women and them actually expressing that they have been touched with what other people are doing out there for them. They were explaining that they no longer have maternal deaths, and this is because they've actually outlawed home deliveries. They are all now coming to the clinics, and the clinic staff are actually overwhelmed. And I think what was most touching for me is to hear stories that the waiting mothers actually sometimes fight for beds because the capacity is now up to full. And to me, that meant that the project has that greater impact.
A success story already. A project that is already changing lives today. Thank you for supporting ADRA. Without your help, we could not do our work.